If there is one thing that the left and the right are united on, even Republican and Democratic politicians are united on, it's that the opioid epidemic is a crisis in America that needs to be addressed, and soon. Conservatives, by the way, didn't care so much when the crack epidemic was affecting more black people a little while ago, but yeah, that's a whole different story. What makes this problem, the opioid problem, unique is that it is one that is largely fueled by big industry, by pharmaceutical companies and their greed. And in many ways, people on both sides of the aisle on the state level are standing up to that powerful industry. So this is the rare story of bipartisan agreement right now in America, where the American people aren't being screwed by their own government. So that's the good news. On Tuesday, Alabama, of all places, filed a lawsuit against the maker of OxyContin, along with other opioids. ABC News elaborates. Alabama Attorney General Steve Marshall, a Republican, filed the lawsuit in Montgomery Federal Court against Purdue Pharma, LP, and its branches. The lawsuit claims the manufacturer engaged in deceptive marketing practices that misled patients and doctors about the benefits of the drugs and the risks of addiction to the powerful painkillers. The Connecticut-based company denied the allegations in a statement, saying it was also troubled by the epidemic and was seeking through specific steps to be part of the solution. The lawsuit alleges the company violated the state law against deceptive marketing practices and created a drug-related public nuisance. Alabama said the company engaged in the marketing campaign so that opioids would be prescribed not just for severe short-term pain, but for more common aches and pains like arthritis, lower back pain, and headaches. But Alabama isn't the only state that's suing opioid manufacturers. At least 13 other states have filed suit against the same manufacturer. Alabama was just the latest to do so, and for good reason. Alabama ranks first in the nation in the number of painkiller prescriptions per capita. Alabama had more than 5.8 million opioid prescriptions written in 2015. That equates to a rate of 1.2 prescriptions per person, the highest rate in the country. By comparison, the national per capita was 0.71 in 2015. The overdose rate in Alabama also increased by 82% from 2006 to 2014. 82%. That's an unbelievable figure. The Obama administration actually put tougher regulations in place on these manufacturers, but it may have backfired. While federal regulations led to an 18% reduction in 2015 of the amount of opioids prescribed, according to the CDC, the decline has fueled a demand for cheaper options. According to the National Institute on Drug Abuse, about 80% of people who use heroin started out with prescription painkillers. So this isn't a problem that just tangentially involves Big Pharma. It starts with Big Pharma, then they go to heroin. So their tactics just exacerbate the problem and begin the problem. And of all of these states and counties are recognizing it too. Independent of the suits against Purdue, over 100 cities and states have filed lawsuits against pharmaceutical companies, starting with, again, weirdly, another red state. In 2015, Mississippi Attorney General Jim Hood became the first state attorney general to sue a prescription drug maker for their role in the opioid epidemic. These cases have drawn comparisons to the lawsuits in the late 1990s against tobacco companies. As it happens, Mississippi led the way on that too. After Mike Moore, the state's then attorney general, took tobacco to court, 40 states followed. The lawsuit is premised on a simple notion, Moore said at the time. You caused the health crisis, you pay for it. And it worked. The tobacco industry was court-ordered to pay more than $200 billion to states over 25 years. That cash is still rolling in and will be until 2025. And as I mentioned, President Obama's administration imposed some stricter regulations at the tail end of his presidency in 2015, after the crisis had already become pretty rampant. Many experts have charged him for being too late on this issue, but President Trump is a whole different story. He is actively neglecting the crisis that Republicans and Democrats on the state level are coming together on. Yes, he declared it a 90-day public health emergency, but that declaration didn't really mean anything at all. Politico reports. The declaration runs out on January 23rd. Obviously, it already did. This is an older article. And beyond drawing more attention to the crisis, virtually nothing of consequence has been done. Trump has not formally proposed any new resources or spending, typically the starting point for any emergency response. He promised to roll out a really tough, really big, really great advertising campaign to spread awareness about addiction, but that has yet to take shape. And key public health and drug posts in the administration remain vacant, so it's not clear who has the authority to get the new programs moving. In addition to that, Trump's undercutting of the Affordable Care Act and the Medicaid expansion is a direct attack on opioid treatment. Medicaid covers around 3 in 10 people who are addicted to opioids, so going after that goes after the treatment. For me, this is an example of local government standing up for their constituents against big industry, and it really colors how corrupted our federal government has become. Yes, I do not discount the racial elements of tackling this crisis and how black people were met with hugely disproportionate jail times and cracking down on them during the crack epidemic. But at least in this instance, it seems like red and blue states are taking a more compassionate approach and hopefully learn something from that. And they're also standing up to a powerful industry in the process, which you're able to do if you're not bought by that industry. In some corners of the country, local government is still responsive to the will and needs of its constituents, and even though our federal government is really soaked in money, stories like this give me hope that public service and democracy are still alive in America.